I knew I wanted to be a physician in college. I started high school not knowing what field I really liked, and biology really took my heart away. Studying the human body was fascinating to me, and I knew I had to do something that involved the life sciences. So as I entered college and thought about what I wanted to do, I spent one summer with a mentor in his office. He happened to be a physician, and watching him with his patients, his interactions, the bond and the trust that his patients instilled in him was really something I knew I wanted to do. And I remember thinking, that's exactly what I want to do someday. I want to be a physician, someone who provides care and is able to apply the life sciences, knowledge about the body in order to better someone's life. What I enjoy most about women's medicine is the ability to be the caretaker for a woman throughout her life. So through adolescence, through their decisions, through family planning, pregnancy, menopause, and beyond, just to take care of a woman and have that bond and relationship with her throughout her life is something I love about the field of obstetrics and gynecology. The most challenging aspect of my job is getting to know the patient. I really enjoy to not only provide them healthcare, but also make sure that I'm a person who they can come to when there's an issue emotionally, mentally, being the person that they can depend on. My most memorable patient encounter is a patient I took care of a couple years back. She had a rare illness, and this resulted in her admission in the hospital for a couple months prior to the delivery of her child. She had issues with language, with expressing herself, and also language barrier. So with all of that, it became very difficult to communicate with her and keep her well informed in the medical process so that she knew what was going on, the changes in her care and her medications. I finally was able to get through to her, and it resulted in a lot of time and face-to-face interaction and being there for her, and she came to trust me. Okay, so if I were to describe myself in 3 words, I would describe myself as personable. I love being around people. It's part of the reason why I chose medicine and OBGYN. I value the human connection, the human contact, and getting to know people from that standpoint. I'm reliable. My goal is to always be there for my family, my friends, and my patients, very importantly, and for them to always know that I am there for them. I'm their biggest cheerleader and making sure to have their best interests at heart. And I am persistent and perseverant. I am willing to go through leaps and bounds to make things work. And while I know my limitations, I take interests of my patients to heart, and I make sure that it gets done. In my spare time, I enjoy spending time with my family and friends here in Orange County, and my biggest hobby is running. So I spend a lot of time outdoors. I'm always looking for the newest trail, the newest running routes. The caliber of the physicians and medical staff is astounding. Everyone is professional, everyone is welcoming, everyone's got a smile on their face. Also, the care that's available for patients is top of the line. It's the newest, most innovative care, from high-level obstetrics to minimally invasive surgery. Being able to provide women with that level of service is unique, and being in an environment where there's multiple providers that practice in that way make it so that everyone's getting the best care.